For this course presentation, I chose several topics that I believe were relevant in preventing juvenile delinquency. Racism involves negative beliefs, actions, and emotions based on race. African Americans in this country experience racism during education, housing, employment, political, social, criminal justice, and health arenas. Most African Americans have experienced racism at some point in their lives, and sometimes they've been unaware. In some instances, African Americans in higher socioeconomic statuses have resources to buffer against racism. Racism still affects all indicators of life. In police violence, blacks are disproportionately killed. Some whites interviewed approved of police violence against other citizens, and they believe that the disparities among African Americans and whites in employment, income, and housing were due to a lack of motivation and willpower. African Americans believe police brutality to be linked to social problems like discrimination and inequality. In criminal justice, African American males are disproportionately represented in the criminal justice system. This is most likely due to institutional racism. Lack of education and criminal justice involvement are directly correlated with the incarceration. The Sentencing Project reports racial minorities are more likely than whites to be arrested, convicted, and given more severe sentences than whites, and 6 times more likely to be incarcerated. Males born today, 1 out of 3 black males born today will go to prison in their lifetime compared to 1 of 17 white males. African American youth account for only 17% of the population, but 46% of juvenile arrests. African Americans make up the majority of prisoners. In health, housing, and mental and psychological well-being, disparities are also created by racism. African Americans have the highest rate of mortality and morbidity, disability rates, the shortest life expectancies, and the least access to health care. There is believed to be more money spent on the technology of care rather than the equity of care. African Americans receive lower quality of care across a range of diseases and clinical services. They have higher mortality rates among minorities who don't receive the same services as whites. There are disparities in appropriate screenings and diagnosis services, as well as treatment of mental health illness. Discrimination in medical treatment triggers stress, and physical and mental well-being is affected. In housing, the Fair Housing Act prohibits discrimination by direct providers of housing such as landlords and real estate companies. Discriminatory practices that make housing unavailable to people because of race still occurs. African Americans are disproportionately provided information about housing opportunities. Racist events affect mental health and psychological well-being across the board. Greater perceived racism equals a greater likelihood of mental distress, depression, and anxiety. Research noted that negative psychological responses to racism have the same reactions as trauma responses. Racism affects psychological well-being of children and adolescents, and discrimination is linked to anxiety, depression, and negative self-esteem. A study of youth ages 12 to 18 reported discrimination linked to anxiety, depression, negative self-esteem, Higher levels of resilience and self-worth and psychological adaptation and psychological adjustment and social and adaptive function were associated with less reported discrimination. Although there are negative effects on health, many African Americans cope and show no negative signs or effects from racism. Neighborhoods are defined as social units or networks of relationships. African Americans are more likely to define neighborhoods based on their social relationships rather than the location that they live in. In disadvantaged neighborhoods, African Americans experience community in neighborhoods the same, and history has segregated African Americans to neighborhoods that vary in resources. Personal sense of identity includes strong membership in African American communities where they live. In disadvantaged neighborhoods, negative factors like birth, out of wedlock births and murder rates, and loss of resources higher socioeconomic status groups have migrated from inner cities and they have transitioned, and these transitions are linked to neighborhood structure and limited access to employment resources. The transitions also mean there are more isolated instances of poverty dispersed over a larger area. Less populated, more abandoned housing, it's a greater opportunity for drug trafficking, drug use, and related crime. The neighborhood and child development are important. Parenting styles are used to buffer the effects of high-risk neighborhoods. Youth monitoring and resource seeking are important. Close parental supervision is also important to these African American parents who have sometimes relocated children because of dangers or exposures in neighborhoods. Identifying resources outside of neighborhoods through other ties is also important. Racial socialization practices that interact with neighborhood factors predict cognitive and behavioral outcomes for African American children. Socialization emphasizing racial pride was associated with high neighborhood social capital, and parents in predominantly African American neighborhoods were more likely to report communicating racial socialization with messages involving mistrust. Low neighborhood risk and high racial socialization associated with higher ethnic identity. Positive community orientation among African Americans see instances like home-based care for family members or close friends, linking caregivers' spirituality and sense of identity in the community. Informal community helping and life satisfaction were reported from helping, and these reports were associated with religiosity. Finances and life satisfaction were also associated with positive experiences of group economic achievement. African Americans are more likely to extend job finding resources to people they know in their own social networks. In the development of African Americans, infants begin their lives at a higher level of risk for preterm birth. The indicated potential link between African American women's higher risk for depression and preterm birth. Those who experience depressions at higher levels and higher levels of stress and anger are at risk for preterm birth and lower birth weights. compared to non-depressed African American mothers. African American babies are less likely to be breastfed, so they're less likely to receive the benefits associated with breastfeeding. Breastfeeding disparities are social characteristics of being single, low socioeconomic statuses, perceptions of breastfeeding, and poor information provided by healthcare providers. Living arrangements and family structure has limited influence on the well-being and development of children. It is a significant predictor of behavioral problems like anxiety and depression. African American parents are more likely to use corporal punishment. African American adolescents growing up in resource-poor communities face challenges in the transition to adulthood. Sometimes having limited access to employment opportunities, they show early expectations of transitions to markers of adult role attainment. Adolescent peers are of increased importance in African American children. Public housing is associated with negative peer groups, but parental monitoring and support are associated with lower levels of negative peer affiliation. Parenting factors are related to mental health. Poor parenting and lower levels of education in parents increase the exposure to violence and lower school connectedness associated with higher levels of aggression and delinquency. African American adolescents are more prone to obesity. They're more sedentary behaviors and because of safety in high-risk communities and limited access to sports. Poor access to healthy and affordable food and cultural patterns of eating contribute to this obesity among African American children. Adolescent childbearing is higher in African American females. That typically following parents' developmental life tasks and education and employment. They are sometimes pushed into adult roles earlier because of limited economic resources. Adulthood in African Americans, understanding the adult development is linked to our cultural ideas as social roles as adults that we fulfill within our communities. Development during childhood and adolescence prepares us to make successful transitions into work relationships and community roles. Older adulthood usually people have experienced some sort of segregation and discrimination in their lifetime. They rely heavily on spirituality as a means of coping with everyday life. The elderly play a very important role in their communities, and the importance of African American grandparents as primary caregivers for grandchildren is seen throughout older adulthood. African Americans living up north report lower levels of psychological distress than those who live in the South. The African perspective on elders they are respected members of the community, and even beyond their lifespan as ancestors, they remain ongoing members of the community. Data on mental health of African Americans. Epidemiology is the study of the rates of incidence and prevalence of a health or mental health condition in a population or a sample of those people. African Americans had lower lifetime rates of psychiatric diagnosis, substance abuse disorders, mood disorders, and anxiety disorders. They are more likely to meet the criteria for personality disorders. The National Survey of Black Americans and the National Survey of American Life studies mental health issues among African Americans. Blacks are more likely to report major depressive disorder as more severe or disabling than whites. Half of blacks who are diagnosed with serious disorders use intervention services to address their distress, and only about 40% specifically use mental health services. Females with higher education and insurance between the ages of 30 and 59 were higher service users. African Americans have a rate of suicide less than other ethnicities. Individuals who are members of racial and ethnic minority groups have more suicides because of increased exposure to stress and discrimination. Suicide rates are higher among males than females, but suicide ideations and feelings of sadness are higher among females than male youth. Statistics suggest that suicidal thoughts and ideations of youth are a concern across all racial and ethnic groups, and suicide prevention is needed within the schools and communities. Mental health service utilization. Males ages 13 to 17 are more likely to receive school or juvenile justice-based services. Parents with college education are more likely to seek services for their children. And African Americans are less likely to receive mental health care. African Americans and Latinos had lower income and levels of education and were more likely to be from urban areas with public insurance and less likely to initiate mental health treatment. Involuntary commitment. And African Americans are still overrepresented among individuals involuntarily committed to public mental hospitals in the United States. States now allow individuals to be legally hospitalized without their consent. Although the rates have declined since the 60s because of legal protections and patient rights and the use of medications, African Americans still continue to be at greater risk for IVCs. Even when factors like poverty and mental health prevalence rates and local rates of mental health services were controlled, race did not appear to account for these differences in commitment. There are many risk factors when it comes to juvenile delinquency. Childhood trauma and trauma symptoms, racial discrimination experiences significantly contributed to juvenile delinquency. Participants who experienced greater racial discrimination had higher post-traumatic stress symptoms and elevated delinquency rates. Race-based trauma experiences help us understand aspects of racial disproportionality in juvenile delinquency. The mental and physical impact of discrimination is important. Experienced racism in African American youth is associated with depressive symptoms like decreased self-esteem and psychological resiliency, as well as increased mental distress, lower academic achievement, anger, aggression, and violence. The Juvenile Justice and Delinquency Prevention Act is a federal law that provides grants to states that follow certain rules and federal protections on the care and treatment of youth in the juvenile justice and criminal justice system. I chose several topics related to the research that I've done from the textbook that I think would make good points or highlights for juvenile justice programs or the prevention of juvenile delinquency. I think mental health services to youth and families is the most important thing when we talk about at-risk youth coming from high-risk neighborhoods, implementing programs that encourage family therapy treatment as well as peer therapy treatment, specifically for race-based trauma. We know that discrimination is important when examining delinquency and disproportionate rates of African American juveniles. Research, of course, suggests that experienced racism by African American youth is correlated with negative consequences. So mental health is very important. I think implementing informal sessions, parent cafes that present resources to families that they may not have access to in their current neighborhoods or communities, showing them things that are outside of their neighborhoods and maybe outside of their social networks that could produce positive outcomes in their children's lives. I think that's important. Allowing open forums for questions and answers for prominent members of the community. This is just a session where parents and families can come together, grandparents, kinship, they can all come together, foster parents, adoptive parents, and ask questions to members of the community about public policy or things they could do to help advance and promote growth in their children. Providing child care is very important for young parents. We want them to be able to continue their education or transition into the employment field, the workforce. So providing child care is very important. I think providing incentives for learning trades and skills versus forcing college enrollment on children or youth who come from at-risk neighborhoods is important. Some of them may not think college is attainable, and I think providing these incentives will help some of them learn these trades and skills that will help them provide for themselves and once they become ready for their families. Promoting community connectedness by hosting events at-risk neighborhoods and communities is important. Seeing servicemen in your community, the police, the firefighters, the mayors, the town councilmen, seeing these people and knowing that they care about the things that are going on in the neighborhood is important to families. And I think that finding funding to encourage readiness to transition into adulthood and the workforce and relationship building is also important. Many of these programs are already implemented in youth who are in substitute care, and I think some of the same things can be done to help prevent juvenile delinquency. Thank you.